Good night, class. As far as this week's assignment, it touched on interprofessional education strategies. What would I realistically implement in the clinical setting? So the one that stood up for me, actually two stood up for me. It was the communication skills lab and the small group. So in the communication skills lab, I feel that it allows the student to collaborate with each other and have teamwork. That way they can have an idea, they can work together as a team, predict what to do next. They can develop technical skill in a supportive environment. It gives them and it allows them a sense of responsibility, and at the same time they can give that patient quality care. And as far as role playing, I think role playing allows the students, it allows them to clarify what each other roles are. Okay, well, you're the nurse, this one is the doctor, this one is the CNA. So, and everyone can take turns so they can understand what each other role is, as far as if you were the provider and if you're the patient and if you're the CNA, if you're the primary nurse, or you're the nurse that's just coming in to help. So it allows each one of us to kind of sense what each other roles are. As far as I know, in regards to educational strategies, I know a lot of universities are using like vSIM, so that does allow students to work independently in a virtual setting. So it allows them to develop their critical thinking skills. As far as in the actual hospital setting, what we do to promote interprofessional collaboration amongst each other is we do huddles. So in the huddles, the different units come together and we discuss what each other needs are for the day and how is it that we can assist each other, such as the med surg, the telemetry, ICU. What we've also done as far as interprofessional collaboration is we do the roundings. We all participate in rounds. So during those roundings, right now during this pandemic, it's been kind of difficult to physically be in rounds, but we do virtual roundings. So within that roundings is we have the doctors, the pharmacists, we have dietitian, we have case managers, we have respiratory therapists. So everybody gives their input on what's going on with the patient. We know for the day, as far as which patient is being discharged home. If any patient needs any DME supplies or any patient needs to go to a rehab, then we collaborate with case managers. If any patient needs, education about diet or any of those stuff, then dietary is involved as well. I think, and for us, what some of the physician has done as far as with our new grads, some of our new grads have had an opportunity to, spend the day with the manager and get to see what the manager's role is. Some of them have had an opportunity to go with the doctors on roundings, so understand what the scope of practice is and everything as far as within each team. So I think that gives us all a better understanding of each other's role. I think the main point of interprofessional collaboration is for all of us, the goal is to prevent readmission, and we have a better understanding of what each other's role is, and our main focus is to provide the highest quality of care to all of our patients, because sometimes we don't really understand each other's role. But if we're placed in that situation where we can at least follow each other for the day and at least have that good communication flow amongst one another, then we have a better understanding of what each other role entails and how is it that we can all assist each other and work together. Thank you.